when it comes to diagnosing patients, if you think about Chinese medicine, they didn't have the X-ray, all these kind of things that we did. So they had to rely on a lot of non-invasive type of technique to diagnose the patients, okay? So, what is this? Oh, this is the way it goes. Okay, so there are 4 methods of diagnosing a patient. The inspection is, the tongue diagnosis is done through inspection, and the pulse taking is done by the palpation, okay? We are not clairvoyant. I had a patient at the clinic told me, Eleanor, he doesn't want acupuncture, he just wants a consultation. I come and talk with the guy and I start to do inquiry, because you're supposed to ask questions about why did you come to see me, how can I help you, asking a question about his medical history. He said, no, I don't want to tell you anything about me. I just want you to take my pulse and tell me what I have. And it's like, oh my God, this guy. And then, can I see a tongue? No, because my tongue is revealing my condition. So I'll keep you now on the edge so that you will know what happened with him. So there is inspection. We have here medical doctor, which we're not going to say who among you is a medical doctor. But you know that when a patient comes through the door, you see them. You see how they walk. You see their gender, their height, their weight, and you get already in your head, already a few things in your head about them, what you think. And then, so you look at their, if they come and, they're working like this, you know that there is something happening, they have some issue, they have some pain. If they're walking like this, maybe a person is a little bit depressed, as opposed to somebody that come and they're walking in. So you're already having in your head some things. As I said, the tongue looking, which is really weird, when I first have patients that this is their first time acupuncture, and I tell them, can you stick your tongue to me, for me? And they're like, what? They're like in a state of shock, just like I was in a state of shock when I came to the United States and somebody stuck their tongue and they had a piercing on their tongue, and I was like, whoo, what's that? I've never seen before somebody that has a piercing. Anyway, then you have to listen to their tone of voice, and like if somebody, you know that they're a deficient person. If somebody comes to you and talk in a loud, robust way, you know that this person has a lot of chi. If somebody tell you that they have a cough and they're like, you know that this is a deficient one. So you're listening to things, you're listening to their tone of voice, you're listening if it's all monotonic, it's if like a type of whining type of voice, if it's going up and down. We do also in Chinese medicine sometimes smelling the body odor of the person, and in the past they used to do with urine. They would inspect it, they would look at it, and then they would smell it so that they can get an idea of what is going on. As I said, inquiring, you ask a lot of questions and then you start to palpate. You palpate the pulse, and you also can palpate the meridians, and you can also palpate the abdomen. When you do, by the way, the inspection in Chinese medicine, there is a lot also that you do looking at the face of the person is also part, you have like face diagnosis as well. Okay, so let's go into tongue diagnosis. The few guys, I never did it when I was your age. I didn't stick my tongue to look and take selfies. Oh, but it is very common to see kids doing that. And once I told my daughter, tell your friend to stop eating pizza, her tongue does not look like she's somebody who needs to eat too much pizza. Started to laugh. But anyway, if we think that this is new generation, actually, I'm hoping that you know who this guy is. The young generation know who this guy is on the yes, you know? You know? Yes? Okay. So apparently, just to give you a little trivia anecdote about this guy, so they were paparazzi. He was invited to a Thanksgiving thing or something, and then the paparazzi came and took his picture, so he stuck his tongue to them, and then it was in the newspaper, and he liked the picture so much that he cut himself out of with the other guys that he was with, and he sent it as his Christmas greeting card. So he's sticking out his tongue, and this one, you know who she is? Yes, she is a famous singer, and look at her tongue. Look just a little bit at her tongue. Let me see.
Yeah.
Can you see her tongue?
Yeah.
Okay, so the tongue is revealing something about her. We're going to go back to it afterwards. So let's see what we are looking at the tongue. So when we are observing at the tongue, we look at the body, we look at the tongue itself, we look at the shape of it. You're going to see the shape you want it to be appropriate to the person's size. Like if you see a little baby and they have the longest tongue, doesn't work. If you see a very skinny person and they have a big tongue, doesn't work. It shouldn't be like this. It has to be proportional to the size of the patient that you're seeing. So you want to see the shape of it, you want to look at the size of it, you want to look at the color of it, and sometimes it's hard to see the color of the tongue because you need to have good light to see, and sometimes the clothing of the person can make the shade, like if they have a red top, then sometimes I try to do this if I'm not so sure, just to put something white so that the red will not give a reflection on the color of their tongue if I'm not so sure. If a person has a dark skin, then you need to look also, because it will look somebody is pale, but no, it's not really pale, it's just they have a darker skin, so you need to take that into consideration. And then not only at the body of the tongue proper itself, we also look at the coating. So some people, they know that I'm going to look at their tongue, so they don't want to look like Miley Cyrus tongue, so they tell me, don't worry, I brushed my tongue before I came. And I tell them, don't do that. I want to see your tongue, how it really is. Even if they brush, after a few hours, the coat will come back. But it depends if they brushed it just before they came. If they have had licorice or candy or a blueberry shake or something like this, you're suddenly going to see that they have a coat that is not. You have pain, huh? You have pain in your shoulder? You do, huh? You see, this is observation. The person is doing like this. I was able, very smartly, to realize that he has shoulder pain. So you look at the coating. You also want to see it's supposed to have a thin coating. This is normal, but sometimes people don't have coating at all, or sometimes they have really very pretty thick type of coating. You want things to be moist, but not too moist. You don't want it to be watery. In Chinese medicine, I tell people that it's many times like Goldilocks. You know Goldilocks? The bed should not be too hard, not too soft, the chair not too tall, not too short. It has to be just right. It has to be, you want the tongue to be tender, so it's not that it's not supple, they cannot move it easily. You want it to be relatively pink, so not too light in color and not too dark red, and you want to have a very thin white coat that is not too watery and it's not too dry. This is a normal type of tongue. So let's do a little bit. Here, one of the things that you can see, this is a tongue map, and all the major internal organs of Chinese medicine are listed here. So the tip of the tongue, the Chinese divide the body into 3 burners. So you have the upper burner that is from above your diaphragm, and you have here 2 major internal organs. One, what do you have above the diaphragm, guys? Even without studying it, you have the heart. What else? What is the other one? Lungs. Okay, and then you have between the diaphragm and the umbilical, the navel. Okay, you have what they call the middle burner, and in the middle burner, you have primarily what we call here the digestive organs, so the spleen and the stomach. In Western medicine, the spleen has different functions than what we call it in Chinese medicine because it's usually the spleen pancreas, so it's related to the digestion, and the stomach, and you have also the liver and the gallbladder, and then from the navel all the way to the end of your pelvis, this is where the kidney and the bladder, also the reproductive system organs are located. So the root of the tongue represents the lower part of your body. The area that is between, in between the navel and the diaphragm is the area of the digestive system, and this is part of the up of the torso. Then this is the lung and the heart. So we look if there are changes or patches or different types of coating or any marks in certain areas, because it tells us a little bit of what is going on in their different organs. But you should know that when we treat somebody in Chinese medicine and we look at their tongue and we take their pulse, okay? It's not just about that. You need to, because both the pulse and the tongue, they can change. There are certain things in the tongue. The tongue body is not going to change, just like this. This is the tongue that you have for many years, and this is the way it's going to look. The coating, if you don't brush it, you can see changes in it. But the pulse that we're going to talk about can definitely change a lot, and we're going to talk. So you have to put everything together. You're looking, you're questioning what the tongue look, what the pulse look, and then you put it all together in order to do your diagnosis. You very seldomly do your diagnosis based on one thing. You have to put things together. So let's look at these tongues. So based on what we said about what is normal, among these 3 tongues, which one do you think represents a normal tongue?
The far left.
The far left, this one is a normal tongue. What would you say about this person's tongue? If you had to describe it, what would you say about it? What does it look to you?
Swollen.
It looks swollen. What else?
White coating.
White coating. What else do you see?
Marks on the side.
Yes, they have teeth marks. We call this scalloped because like a scallop has sometimes. So yes, teeth mark. So usually it's because they have a swollen tongue. This is why they get it. Okay, what do you think about the color of it? Does it look normal color? No, it looks a little bit palish, correct? In comparison, like the skin tone of this guy and this guy look to be the same, okay? So there is no skin color that we can accuse. Do you want me to do this so you can see it a little bit better? Okay, so these 2 people have approximately the same skin color, And yet you see that this is paler than this. And what about this guy? What do you see about him? Don't worry, you're not tested on it. You're not going to get a grade, and you're not necessarily going to be disqualified from enrollment here if you say the wrong answer.
Inflamed.
Huh?
Inflamed.
So why do you say inflamed?
Like it's a red color, but it just looks like kind of like an angry red.
It's an angry red, yes, it is pretty red. You see also that his facial complexion is a little bit on the red side. In Chinese medicine, when you see something that is red, what do you think that happens with this person?
Heat.
There is heat inside their body. So when you have heat inside their body can translate in different things. It can be that they have high blood pressure. Sometimes when you get upset, you feel, you know, the heat goes up to you, you feel, or you're anxious, you meet someone, you have to give a lecture, you become all red because you're really anxious and you start to feel hot. It can be that somebody is in menopause, they have heat, so they have heat that goes up because heat, I don't know if he said this or not, but heat usually tends to be going upward. This is the nature of heat. It goes upward. This is why if you have a penthouse, it's really nice. It's cooler down and it's hot more upward because this is the nature of heat. And it can be somebody that has a systemic inflammation in their body, like they can have high cholesterol, or they can have, you know, a colitis or something like this. They have an inflammation in their body, or they can have an infection. It can be that they have just a sore throat or something like this. So you have to put all the details together to try and see. What do you think about the coating? Does this person has coating on their tongue? Does not have so much coating? What do you feel about it? Not much of a coat. And also you see it has a lot of little, it's not the best picture, but it does have a lot of cracks on this type of tongue. What?
Is it dry?
It's
It looks cracked and
not,
pitted.
yeah, sometimes cracks tells you about dryness because you compare it to, as I said, the Chinese took what you see in the universe and applied it the same things you see inside your body. So just like when the earth, you see it all cracked, what does it mean? It's dry, it needs some water. So I tell my patients, if you think about hydrating yourself, if I see that the tongue is super cracked and it means that they need to drink more fluids, don't drink it like there is thunder and rains that don't stop, because what happens with the earth when you have rain non-stop, it all goes down towards the ocean. It doesn't stay. So you want it to drizzle and then the earth is going to absorb it. So it's better if you sip throughout the day and not glue, finish a whole water bottle like this and then you don't drink the whole day. Okay, so you want to sip throughout the day. Oh, did I do okay? Okay. Let's move to the next one. A little bit, so you see some additional ones. So you see here, you can definitely see here a little bit more of the crack that the person, it's a what we call yin deficiency. In Chinese medicine you have yin and yang. They both have to be approximately balanced. It changes with your gender, it changes with your age, it changes with the time of the day, but you want them approximately to be balanced. But in this person, they have less yin. Yin is more coolness, it's more substance, yang is more energy and heat. So when the yin is low, you may have as if more heat. You don't necessarily have heat, what we call true heat, but in comparison, if this is yang and this is yin, it would look that you have too much heat. So you see that the tongue is red, that the tongue is cracked. This person may be menopausal. You can see that it's also maybe a little bit also puffy, a little bit. It's more swollen. This one is interesting. So if you had to describe it, what would you say? I don't know your names, otherwise I would point to you and tell you. What would you say about this tongue? What is interesting about this one?
Spotty patching.
So it has spotty, so you see here in the middle as if you don't have any coating. And then in the back, you have what kind of coat? It's a thick white type of coat. So they have these people. Do you remember what area of the body is represented in the middle of the tongue?
Stomach.
The stomach spleen. So this person have what we call, just like here he doesn't have, we said that it's in deficiency also this person, but they have stomach yin deficiency. And it can be caused from a variety of things. But this person, their digestive system is not functioning. They can have, a person with a stomach yin deficiency can be like somebody that have sometimes diabetes. And you see that they have a lot of coating, actually quite thick and white. So they can have also some things in their intestines that they have like phlegm and dampness in their intestines. And if you look at this third type of guy, also this tongue is a little bit swollen. If you look a little bit of the face, it doesn't look like necessarily an obese type of person, so it looks a little bit swollen. This guy, you see that the front does not have so much coating in the front, so the area of the heart and the lung, but they have thick coating. They have a dark coating in the back. Sometimes you need to ask, did you drink a lot of teas? Do you smoke cigarettes? Because this can also make it a little bit darker. But they have more of a brownish type. Usually if it's more heat, you know, we would need to look somebody like this, what is happening with their elimination system, whether it is their bladder or whether it is their intestine, what is going on with them. So then we go into pulse diagnosis. So when we do the pulse, I tell my patients when they come and they ask about the pulse, I'm not going to look at the pulse and tell you that at the age of 5 you had a fight with your brother and he knocked your tooth or something like this. I'm not a clairvoyant. Actually doing proper pulse diagnosis is pretty challenging and difficult to do. It tells us about every area, and let me show you here, every position when we take the pulse of the patient, we put it on the radial artery, and we have to put our fingers depending on the height. So if I have somebody that is really tall, I spread a little bit my fingers. If I have somebody that is really short, then I put it really close together. And it tells me about the different internal organs depending on the size of the hand. So as you can see, the upper part of the body, the lungs and the heart, are more distal towards the wrist. So the heart points towards the left, so it shows you the first position will show you the heart, and on the other side it's the lung. Then we go into the middle burner, and we'll see what is happening with the condition of the spleen and the liver. And then the last proximal, so closer to the body, will be the kidney, either the kidney yang or the kidney yin. So we look at these things, we put our fingers, and it tells us the condition of the different internal organs. We do different pressures. We start by just putting our fingers and see if the pulse is going up towards our finger. Sometimes you feel, boom, boom, boom. Sometimes, like you feel nothing, Sometimes I have to put a lot of pressure. It's like the person, I call it, does not have oomph. They're like extremely lethargic. Sometimes the patient does not look like this. They look with a lot of energy. I try to put like nothing. I have to push so much. Like, what is wrong? Sometimes it's with people that have trust issues, so it doesn't come until they get to know you, and then the pulse will change. It can tell me about the cause of disease because different types of pulses, there are about 28 different types of pulses, can tell you what is going on with the person, and it can tell you what would you expect. So sometimes when a person is very weak, when the pulse is very weak, it will take a long time to make them feel better. Because to destroy something very quickly, to build something, it takes time. So it can tell me about the progress, how is their constitution and what is their condition, and can I help them to do things quickly. So we look at the speed. Sometimes it can be just rapid, just because a person, it's the first time that they meet you, you have a white coat, and they got all a little bit anxious, or it's their first time getting acupuncture. It can be rapid, but not really, because they have heat inside their bodies. They're just a little bit anxious. We look at the different qualities, which is the 28 different qualities, and we look at the rhythm. Some people have irregular pulses. Sometimes it's regularly irregular, and sometimes it's irregular type of pulse. And we look at the depth. Do we feel it when it's just gentle, or do we have to go deep inside? Also, the different organs, they're divided into yin and yang. The top one is the yang organ, more deep is the yin organ. We're going to study all these kind of things. So, talk about, yes.
When you said the top one was the yang and the bottom was the yin, did you say on like one hand was liver yin and one was like, so how is it separated?
So for example, if this is the liver, so the liver is partnered with the gallbladder. So the superficial pulse of that middle position on the left hand will be the gallbladder. And then if I go deeper, is the liver situation. If the spleen and the stomach are together, the stomach is the yang organ, so the superficial will be the yang and the deep will be the yin. This hand, the kidney is the kidney yang, so the kidney energy more. And this one is the kidney yin, so it's more the substance, like the hormonal. So hormones are substances. And this one is more energy. So if I see an elderly woman, for example, and she has her pulse, I check, and I see that it's really low, then I remember I was in a health fair outside somewhere in Santa Cruz, and I asked her, do you have problem with, how do you call it, bladder control? Yes. And she looked at me and she's like, how do you know? But you just put one and two together. She's an elderly woman. Sometimes they lose height. Sometimes they lose their ability. The kidney yang is really low, meaning she doesn't have energy to close the sphincters. So you put one and one together and you can. And just like this person, on this, wait, I go back up, here. So I was at Cabrillo College and we did tongue and pulse diagnosis, and this woman stuck her tongue to me and she said, what do you think I have? And on the side here, she had like purple stain there, like blood. And I asked, did your dentist see that? Is there anything? No, she said, I always had it, dentist, not worried about it, never grew, she has it. So the liver and gallbladder are related a lot sometimes to the menstrual cycle, the uterus situation, migraine headaches, especially if the headaches are in this part of the body. So I asked her, do you have migraine headache? And she said, no, I don't have. And then I asked her, do you have, because she had this spot like this, I asked her, do you have a fibroid in your uterus? So she looked at me, she didn't say anything, she turned and she left. I don't know till this day if she has a fibroid in her uterus, but she was like, how do you know that I have this? This is my take on her. How does your tongue? So not always, not everyone that has this has a fibroid in their uterus, but this was, I feel, for them. So remember I told you about this guy, he didn't want to tell me anything about him. So what I felt in his pulse, when I took his pulse, and he doesn't know that when he talks I can see a little bit, because at the time we didn't have masks, so you could see a little bit of the tongue. So I had a peek even though he didn't want to show me his tongue. So I take his pulse and I see that his pulse is very slippery. What does it mean, slippery? Is as if you take pearls, so round beads, and you put them on a plate, and then you roll gently your fingers above it, and it feels bloop, 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 like this. So this is called slippery. This many times indicates that the person's digestive system, that the spleen energy, the digestive energy, spleen pancreas is not working well. So I told him, your digestive energy is not working well. And he was very upset. And I said, what? Why are you so upset? He said, you don't know how many thousands of dollars of supplements I took. All the time people tell me that I have this problem with this digestive system. I said, listen, show me your tongue. He showed me this tongue, definitely had spleen. The tongue's puffy, has thick coating in it. So I start talking to him. Apparently he lived in India for many years. Actually he was on his way to India. A lot of time when people who are not Indian go the first time to live in India, they catch different things. So he had giardia or something like this that he caught many years ago. This is why he got so many treatments to improve his digestive system. So I told him, listen, it shows that you have something in your digestive system. It might be that now everything is fine, but this is your weakest link. So you need to be careful so that you know what you eat and what you drink when you're abroad, so that you're not going to have it there. So then he was okay with that, and I gave him some herbs that we give for people who want to go traveling. So this is the end of my lecture today.